Medicine here in the East, new findings, research, and hands-on training were some of the biggest topics of the year. WNCT's Kara Gann breaks down some of the top local health stories of 2018.
The Centers for Disease Control reported sexually transmitted diseases have been on the rise for the past 5 years.
Anytime you see a rise in STDs, you see that people are not protecting themselves from it.
A fact that's encouraging medical professionals and students to take action.
Just because you're not feeling any burning sensation, you're not noticing anything different, does not mean that you're not carrying an STD.
Samantha Foster and her honors project group called Let's Talk About Sex have been trying to raise awareness on campus.
It's a very big issue. It's a student's issue. We found out that students knew about safe sex and that they should use protection, but they just weren't. And not many students knew how to get tested or how that process was.
Also this year at ECU, a researcher has been working to find a better way to treat Lyme disease. Dr. M.D. Muttaleb and his team have been studying the movement of the disease bacteria with the hopes of creating an antibacterial medication that will stop the flow of the disease in the body.
The bacteria, if they cannot survive, then the disease is basically cured.
Dr. Muttaleb is hoping to one day develop a cure. And just as researchers work to better their skills, students did too. ECU's Brody School of Medicine and the College of Nursing took part in a live-action mass casualty training session.
The first time that you're ever in a crisis scenario can be frightening to many. So the more training that we can have when we're in school before we have to ever act in real life is great.
Students had the chance to practice giving IVs, packing wounds, and learn different airway management skills.
If we're able to create those skills, hopefully when an actual disaster comes, they'll be able to pull those out and properly execute their job and empower others who didn't have that training.
2018 was also a big year for mental health research and awareness. Trillium Health Resources in Greenville is one of the leading players. Researchers found the need for mental health resources for communities impacted by Hurricane Florence increased by 45% compared to the need before the storm.
Because Florence was such a bigger storm and covered such a much larger area of the state, and it moved so slow, we know we're going to have a dramatic impact.
Especially for children under the age of 13.
Driving in and out of your neighborhood every day with all of the contents of the houses are on the street, and children seeing that every day, that's a really different impact on their ability to understand a safe community and a safe life.
ECU also held a mental health awareness event. The university hosted Fresh Check Day for students on campus. Vidant Health also started a new program to help patients cope with loss and grief called Living On After Loss. Those are your top Health Watch stories. I'm Kara Gann, 9 on your side.